This is Dr. Alex Frantzis. Thank you. He's an osteopathic physician based in California. He's looking at moving to Maui, but he's been practicing in California for some time. He's an osteopathic physician. He believes in the value of spinal manipulation and cranial osteopathy, which is dealing with, there's like cranial sacral syndromes. He's very expert at that, has been helping so many people in these various ways through the years because of that background that he has in neuromusculoskeletal medicine. So we're going to have him take a few minutes here, about 15 minutes, and talk about some of these topics and the value of it. And right here is for your slides. Thank you very much.
Okay. I was really interested in integrative medicine, and over time I gravitated towards osteopathy, partly because it really fit with my personality, partly because I saw it really help people, and partly because I found that it was really safe, and I would often see other things that people tried not work out so well. One of the things osteopathy is known for is it has a different way of looking at the body that provides a lot of insights into problems other perspectives can't get. And oftentimes, osteopaths end up being the ones that people eventually seek out for complex medical problems they're not really sure what to do with. So as you might guess, throughout COVID-19, the people in my field got very busy, and we gradually got an idea of what COVID did as each stage went through. This is a picture of me and my wife, who's also a cranial osteopath, working on someone who had COVID in the ICU. And this was taken at a time when basically most of the people were deathly afraid of coming near anyone with COVID, and they were mostly just isolated, kept away. So, first things first, I think a lot of you are familiar with the theory that if a bone is out of place, it can cause a little bit of pain because it impinges something. For instance, if your vertebrae is out, it squeezes on a nerve, and then you have a little bit of back pain. The same way that happens, you can have a lot of other compressions in your body that also cause issues. For example, one that I see a lot is this muscle is the piriformis. It sits right on top of the sciatic nerve. When it's tight, it pinches the nerve. And this, in my opinion, is the most common cause of sciatica. So we often see people that have years of sciatica. You get that muscle to release, the sciatic pain goes away. Similarly, if you take this idea a bit more broadly, one of the things I've always been astounded by is how often with back pain, the root problem is just that either of these two muscles, which attach to the lumbar spine, one of them being tight or both, creates chronic back pain. And the thing with these compressions is that beyond the fact that they can cause physical pain by locking something up, they also often compress critically important structures, such as a blood vessel that blood moves through. Now, another thing to think of is that beyond things being out of place causing pain because they're compressed, they also function as a bad gear that jams up the body. And one of the things we don't really appreciate is that anytime we move, a whole bunch of things in the body have to all move in coordination. And we just normally don't notice because all the gears work and they're lubricated. But when one jams up, you very quickly can get a lot of other problems emerging from that stuck gear. One simple example, this is the shoulder. Shoulder's an interesting structure because effectively it has to be able to move in every single direction while bearing and maintaining a load, which is a very difficult engineering challenge. And the way nature solved it was by having the shoulder effectively be like a suction cup that sits in the joint, and then the pressure of the muscles on top pushes it in so it stays in the suction cup, and at the same time all the muscles fire in their own coordinated way to get the shoulder to move however it needs to. And if you think about the setup, you can see how if one of the muscles got too tight or stuck, it would lock and freeze up the shoulder. And that's exactly what we see in clinical practice, where oftentimes people with chronic shoulder issues, it's just one or two muscles that got too tight and they never got loosened up. Now, what I all want you to do for a moment is just take a deep breath and with your belly, and just for a moment try to notice how many different things in your body have to move. And the reality is, unless you say have a rib that's out of place, which can make it very difficult to take a breath in, or you're in a state where you have compromised respiration already from something like COPD, you normally don't notice all this little resistance because your body can compensate for it and you breathe anyways. But when you have patients who become critically ill, such as, for instance, what we saw in COVID-19, all that extra resistance really adds up. For example, in pneumonia, what happens is that your lungs overload with fluid to the state that you're effectively drowning from the inside, and it takes a lot more work to get air to come in and out of the lungs. And so one of the things why we ventilate people in medicine, even though we know that it can be very dangerous, is because otherwise when people have that extra resistance on them, eventually they fatigue and run out of energy. They can't breathe anymore and they enter respiratory failure. And one of the things that we found really surprising throughout COVID-19 was that we would have patients in the ER who were starting to go into respiratory failure, and all we really did was loosen up the places that we could feel in their rib cage that were stuck, so they had a bit less of a resistance on them to breathe, and that was enough to pull them out of respiratory failure and keep them from being vented. And now, the next thing about this, though, is one of the big problems we have in medicine is that we always look at one part of the body being a single, individual, isolated part, when the reality is every single part of it's connected. And so using the breathing model, for instance, a lot of times there can be something outside the rib cage, which is actually what's jamming up breathing. And one that I've seen quite a few times I think shows this problem is someone who had chronic TMJ pain in the jaw, which made it difficult for them to chew. It was coming from the fact a bone in their ankle was out of place. And through this line of fascia, this picture showing it jammed and pulled the temporal bone out as well. Now, at the time, when most of us, when we think of manipulation, we assume that it's for treating musculoskeletal pain. And I think that came about because there's always going to be a market for that, and it's very concrete to understand this is out of place, it causes pain. But the time osteopathy was developed, it was actually made primarily for treating severe illnesses. And at the time this happened, as much as people may have questions about how medicine is conducted now, the drugs in the past were much more dangerous. For instance, mercury was something that was commonly prescribed for everything. And osteopathy kind of came about as a way of like, how can we A, have an effective way to treat illnesses, and B, have it be something that's relatively safe. And one of the big insights the founder of osteopathy had was that those compressions, beyond causing musculoskeletal pain, could also stop the flow of things in the body that were critical for life functioning. Now, if we think about this with blood, it's an easy concept to understand. For example, if you have the blood flow in the heart be blocked, you get a heart attack. And if you have the blood flow in the brain be blocked, you rapidly get a stroke. But at the same time, there's also a lot of subtle obstructions to circulation we don't think about as much. One example would be people often, as they get older, get a partial obstruction of blood flow to the eye, and that leads them down the path to macular degeneration, losing their sight unless the blood flow is addressed there. Similarly, this artery, which is called the vertebral artery right here on the side of the neck, it feeds all of the cranial nerves and the brainstem, and as a result, when blood flow to it becomes compromised, you get a lot of other problems such as dizziness, tinnitus, or hearing loss. And the last one, there's tons of other examples I could give, is commonly you find with patients after a stroke, there's poor blood flow in the brain, which makes sense because the stroke came from poor blood flow, and unless that blood flow is restored, a lot of the recovery can't happen. Now, another big concept to understand is that we always have waves of force move through our body. So when I'm walking, each time I take a step, there's a wave of force coming up from the ground. It comes up, I land, and it passes through my body. That's what should happen normally. But that's not always what happens. The best metaphor I found for this is if you were ever to try to take a stick between your hands and crush it, it's almost impossible to break it if it's straight. Whereas if there's a tiny kink in the stick, it immediately will snap where the kink is because the force switches from being a horizontal vector that passes through to one that has a shearing force that goes in the opposite direction where it is. And one way you can think of this is with the knees, where once the knees get out of alignment, rather than the force going straight through them, they concentrate at the knee joint, and over time that wears the knee down until someone needs to get a knee replacement. And beyond this relating to knee pain, there's two reasons why I think this principle is really important to grasp. The first one is that same disruption of flow or force vectors going through can also happen within the blood vessels. And if you switch from having a straight flow of blood to one where the vectors deviate, you can often have an obstruction of the circulation that goes through. The second one, if you look at these examples with the knees where the force is going in, the thing that counteracts having bad alignments in your body that put strain on it are your ligaments. And so the body always has a certain amount of ability to compensate for something being out of place or extra strain being put on it. But what always happens is that people pass a critical point where there's too much stress on their body, and all the compensations they had, which previously were in the background and they never really thought about, no longer can be maintained, and everything else starts to shut down. Now, within critical illness, the most important circulation is the lymphatic system, and it can kind of be thought of as a sewer system which drains all the fluids from the body and all the waste products. Using pneumonia as an example, pneumonia, the fluid in your lungs builds up because you have an inflammatory process which releases fluid, and gradually the fluid builds up in your lungs until you start to drown. The lymphatic system is responsible for draining that fluid out of the lungs. And so as a result, when you do something to work on the lymphatic system, you can significantly improve the outcomes with pneumonia, since the main thing that gets you, draining on the fluids, gets mitigated. Now, at the time that osteopathy was founded, by the time 1918 had come around, it had basically largely switched to being a musculoskeletal-based practice. And in 1918, we had possibly one of the worst infectious diseases in history. The only thing I think is comparable to it was the Black Death. And it's really difficult to understand how bad the 1918 influenza was unless you were around at that time. But one of the things the osteopaths in practice discovered was that the methods they had learned were remarkably effective for saving people's lives from the 1918 influenza. And my favorite anecdote I found from one of the medical journals at the time was that there was one guy who was in a county who had lots of sick patients he was attending to who were on death's doorstep. And he had so little time to treat people, or so little time to sleep, that the only time he could actually sleep was when he was riding on his horse from patient to patient to patient. And he somehow trained the horse to know where to go, let him sleep while I was going, and then at each house they would get woken up. And I will give full disclosure, that's not the horse that he used. This was just a picture I pulled from Google. And so when it was all said and done during the 1918 influenza, there was roughly a 20-fold difference in the death rate between people who were treated with the standard medical care at the time and people who got osteopathic manipulation. The difference got a little bit smaller when people are already critically ill with pneumonia, but it was still that same general thing where there was a massive difference. And that really was one of the things that put osteopathy on the map. And since I love history, I've read through so many reports of what was found at this time. And one of the things I always wondered was, if I had been around at that time, what would I have done? Would I have had the courage to go see all these people? And what would it have been like? So when COVID-19 started emerging, it immediately seemed to me like this might be like the exact same thing pretty much a century later. What can I do? And it just so happened that there's only a few places in the country that still train physicians to specialize in osteopathy, but one of them was located in the Bronx, and that happened to be one of the worst hit places in the United States initially with COVID-19. So when it occurred, I was actively corresponding with my friends there about what they were noticing, and I ended up having to fly around the country to see a lot of different people I knew who were also really ill with COVID at the very start of the pandemic. So I'm very grateful I did that. And so some of the things that we all found with COVID were that we saw a lot of the same changes that were typically found in pneumonia, like the gears of the diaphragm locking up. But there were also some very unusual changes. The first one was that the fight or flight part of your nervous system became hyperactive. And this is one of those things that's a little difficult to comprehend unless you experience it directly. It was a very odd experience for me when I had COVID. The second one was that fluids throughout the body seemed to freeze. And I know you're familiar with this idea with blood clots in the blood, but we saw it in other ones too. For instance, the lymphatic system, it would seem as though it solidified and it got stuck. And it took me a bit to figure out how to address it, but eventually I realized that if you could free up or break up the lymphatic stagnation, that gave the most immediate and dramatic results in improving people's conditions with COVID. Another one was that the cerebral spinal fluid also would freeze up, which is very disconcerting to a lot of us because we'd never seen that before. And the cerebral spinal fluid, for reference, that's the thing that's inside your spinal cord and inside your brain that nurtures it. And to share one anecdote of this, recently my father was hospitalized with COVID-19, and I did a lot of protocols for him remotely, so I never felt that his life was in danger. But one of the problems was that once he was in the hospital, he started having pretty significant delirium, and nobody could deal with it. And I put off doing anything about it because he was out of state for me. Yeah, I put off going off to see him just because I worked out of state. But essentially, once I came and saw him, I noticed that some of the CSF in his brain was just frozen. And once I got it to move, all his cognition came back and he stopped being delirious. And there were other qualities as well that we saw with it, but the big thing was just all the fluid froze up. And one of the big things I noticed was that in the arteries in the body, especially in the pulmonary artery, you notice an obstruction of flow within them. And that ended up often being one of the most important things to do. Now, the next part of this, where we're going to tie it into, is with cranial osteopathy. All the principles I told you just held true, but they're a lot more important than the skull, partially because it's a very, very tightly packed box, and a lot of critically important structures go through it. And so as a result, number one, if something gets slightly out of place, one of the gears, because a whole bunch of bones and the membrane and the skull are always moving, they will lock up and jam up the whole thing. And the second one is that because there's so little space, it's very easy for something to get impinged or stuck. One example of this, and I want to just give the disclaimer, there are hundreds of structures passing through. This is just one example. You have an artery and a nerve which go through this part of the sphenoid bone. When they get pinched, you start losing visual function. And when you move the sphenoid back into place, they stop being pinched. Another one is that anytime you have a concussion, you get structures in the brain that become chronically compressed. A good example that I've seen a few times is that a part of the brain that's being pointed to with the arrow is where the part of your brain is which controls your ability to speak. And I've seen numerous people that had a concussion that compressed that spot, and until it got decompressed, a lot of their verbal function was lost. The last one, and this ties a lot in the whole COVID picture, is that we have a nerve that exits down the back of the head, which is known as the vagal nerve. And the spot that it's in is chronically compressed because there's muscles that lie over it that become chronically tight whenever because we look at screens all the time. And so one of the things we found with a lot of the COVID patients, both acute and chronically ill, is that you have to decompress the vagus nerve, and a lot of the unique symptoms that come with it, they're directly related to vagal dysfunction. Now, within chronic illnesses, which is often what we see cranial osteopaths are sought out for, there's a big change that occurs. If you look on the left, you can see how there's quite a bit of wiggle room you have for how far you have to knock something out of place before you get the structure being impinged. But whenever you have a chronic inflammatory state occurring, you have much less wiggle room, and it's much easier for something to get impinged. And effectively, what we've seen from working with a lot of acute and chronic COVID patients is that those little misalignments that are in their body that previously didn't notice, because of the extra inflammatory load that's there's a very pronounced and evident compression that you can notice. The other thing that's a little bit unique about COVID is it'll cause long tracts of tissue in the body to tighten up, and anything that's under them gets compressed. For instance, in the ear, there's a tract that goes around the eustachian tube, and once it tightens, fluid doesn't drain from the ear, which is a very common complaint you hear after COVID. Another one is that there's a fascial tract that goes up the nose that compresses the nerve that you use to smell. And oftentimes, until that gets decompressed, people lose their ability to smell because the nerve's being pinched, so it can't do what it thinks. And so with osteopathy and chronic COVID, the big things that we've noticed are treating all those little misalignments in the body, especially in the cranium, can make a huge impact in symptoms. And I know a lot of cranial osteopaths who are having people come from hundreds of miles away in order to see them. The second one we found is that oftentimes these treatments don't hold. There's like an improvement, but then it gradually starts to come back unless some type of a systemic integrative therapy is done in parallel. Conversely, whole body therapies like some of the ones you've heard about today, even though they generally improve a patient, there's always key symptoms that remain that can't be gotten out unless osteopathic manipulation is done in parallel to decompress those areas. And now, one of the big themes that we're kind of hoping will come out of this the last few years is the idea, number one, that everything in the body, mind, and spirit are interconnected. For instance, the gears I was talking about earlier. The second one is that whenever you practice any type of an integrative medicine, it's largely a guess and check method of what do I think is going to help the person the most, try it, if it doesn't work, switch to something else. And that's not, when you do osteopathy and you really connect and feel the tissue in the body, it gives you a completely different way to guide what you want to choose, because oftentimes you'll notice there's very specific qualities in the tissue that say you should do this or that. For instance, you can feel fluid is obstructed, which means you have to do something to open up the fluid circulation there, like an IV, or you can tell this nerve is overacting and you have to give an injection to make the nerve calm down. And so I thank you all for listening to this. The trajectory of my life was really changed by cranial osteopathy when I was 13 because I had a traumatic brain injury, and I really don't know where I would have ended up had I not had access to a good cranial osteopath. Unfortunately, since this is a slightly challenging skill set to learn and there's not many training avenues for it, there's a relatively small number of people doing this, so a large part of my focus has been both to bring awareness to what this can offer people and also to train people at a lot of different levels. And so we really appreciate how receptive Hawaii has been to us. When I made this PowerPoint, it said Maui, but I have nothing against Kauai.